Hi, welcome to the first podcast in your course, Geography 320, Health, Wellbeing and Geography. In this podcast, and in the ones that follow, I introduce an idea, topic, or concept, and offer some reflections, examples, and applications. I do this to complement the commentary I provided in your study guide, and the learning activities assigned throughout the course. In these podcasts, I make reference to your textbook, assigned unit readings, and other sources. You can find a list of these other sources on the course's main page and at the end of this podcast. In this unit, Unit 1, you are introduced to several different explanatory frameworks used by geographers to identify, explain, and understand the relationships between health, well-being, and geography. To refresh your memory, these frameworks are positivism, social interactionism, social constructivism, structuralism, structuration theory, and post-structuralism. One framework not mentioned is complexity theory. Complexity theory invites us to think about the world in terms of its interrelatedness and unpredictability. This theory suggests that we cannot predict the behavior of a system based upon our knowledge of its various parts and how we think they fit together, nor can we predict their behavior based upon prior knowledge of their qualities or how these parts behave in other systems. This is because when these parts come together, they cause unexpected and uneven effects, some of which are short-lived and some of which are more sustained and intense, which can transform the system altogether. Complexity theory suggests that systems are far from stable and predictable because they are produced by the interactions between parts. Disease outbreaks and our responses to them provide illuminating case studies for exploring complexity as a fundamental context of health and well-being. If you consider the post-game analysis, so to speak, of any one of the major disease outbreaks of the last decade, H1N1, also known as swine flu, avian flu, or most recently Ebola, you find a common assessment. We were caught by surprise. Caught by surprise despite the millions upon millions of dollars spent on preparedness in the form of surveillance and detection programs, laboratory research, and treatment and containment plans. What is at the heart of this shock and unpreparedness? This is where complexity theory can come in handy. Consider the recent Ebola outbreak, for example. Despite a good understanding of the virus and its ecology, and the existence of emergency response protocols and plans, the outbreak seemed to spiral out of control in the first few months. Consider this. On the eve of the outbreak in West Africa, we knew more about the virus and had planned for Ebola emergencies more than we had ever before in human history. Yet it nonetheless became the biggest outbreak in the virus's history. Complexity theory is well suited for accounting for the unpredictability and volatility of disease ecologies. This term, disease ecology, is introduced in Chapter 1 of your textbook, and you will revisit it later in Units 4 and 6. The disease ecology approach posits that to understand an infectious disease, such as Ebola, we must understand how it is situated among the physical and biological elements of local and regional settings. It is well understood that bats and other animals are susceptible to Ebola and can pass the infection to humans who might eat infected animals. This ecology has been well understood for 25 years. But to understand the latest outbreak, we must consider not just the biophysical environment and the viruses and the host's place in it, but also administrative, political, medical, and cultural environments. It is these various environments or parts and their interactions that compose Ebola's disease ecology in West Africa. In a nice piece on the Ebola outbreak in the anthropology journal Limb, Andrew Lakoff points to some of these environments to explain why Ebola caught everyone by surprise. Prior to spring of 2014, Ebola was well understood in terms of its virulence and transmission, and was seen as a virus that had, to date, been endemic to relatively small and isolated geographic areas. A global surveillance and outbreak response system, focused on rapid detection and containment, was built upon this understanding of Ebola as an incredibly contagious but geographically isolated virus. Lakoff points out that the Ebola outbreak over the summer and fall of 2014 was driven not by the severity of the virus per se, but by the absence of basic health infrastructure, the limited capacities of humanitarian medical organizations, and the general public's lack of trust in authorities. This made it extremely difficult to isolate patients, trace contacts between infected individuals, and manage the spread of the disease. These absences and deficiencies are not simply local matters. In a recent article appearing in the journal Lancet, linkages are drawn between these local conditions, particularly the weakness of local health systems, and global institutions such as the International Monetary Fund. The countries at the epicenter of the outbreak, Liberia, Sierra Leone, and Guinea, have all been under IMF development programs, which required, among many things, reductions in government spending to facilitate debt reservicing, capping of spending on public sector wages, and decentralization of health systems. As a result, spending on social and health programs suffered. Highly qualified health personnel immigrated to other countries, and the quality of health service delivery deteriorated. As Lakoff in his article suggests, in seeing the ecology of Ebola as one that could be managed through local efforts and infrastructures, global health authorities did not appreciate the full complexity of the outbreak because they could not foresee the way these administrative, political, medical, and cultural environments would interact. In a review article from a decade ago, medical geographer Anthony Gatrell lists 4 key features of complexity theory. These features can be used as helpful thinking tools for further understanding the disease ecology of the Ebola outbreak. The first key feature is thinking about disease ecologies as a constellation of networks. In this regard, we can identify a number of networks that bear upon the transmission of Ebola. The transmission chains by which the virus is spread from host to host is one that immediately comes to mind. Because of the inadequacy of health infrastructures, a significant number of infected individuals were cared for at home by family members who subsequently were infected. This is just one example of how one network, transmission chains, intersect with other networks, family networks, and medical networks, for example. The second key features of complexity theory is thinking about disease ecologies in terms of non-linearity. What this means is that small changes can have large effects. Effects are not proportional. Consider, for example, a scenario where an infected individual is cared for at home among spouses, parents, children, or siblings. In the absence of isolation, exposures from a single case can be exponential. The third key feature of complexity theory involves thinking about disease ecologies in terms of emergence. Specifically, the emergence of new system properties or forms of self-organization. The disease ecology that emerged in and across high transmission countries such as Guinea, Liberia, Sierra Leone, other West African countries such as Mali, Nigeria, Senegal, European countries such as Spain and the United Kingdom, and here in North America in countries such as the United States. These represented an ecology never before seen. It also triggered a global response. Ebola, once a regional concern, became a global concern. The fourth key feature of complexity theory involves thinking about disease ecologies in terms of hybrids. This refers to the connectivity between physical and social relations. Ebola is a virus that evokes a physical immune response in its hosts, and the immune response itself, vomiting, bleeding, diarrhea, facilitates the exposure of the virus to others. But a whole host of administrative, political, technological, and cultural relations shape whether an exposure becomes a transmission. In this sense, it is helpful to think about Ebola's disease ecology as a hybrid of physical, social, and cultural relations. So, in summary, What is the relevance of this theory to health geography? As Anthony Gatrell argues, complexity cannot be modeled as a linear relationship. Health outcome Y is caused by health determinant X, for example. Complexity theory, applied to health, demands a relational view of health, space, and place, while at the same time calls for greater sensitivity to unforeseen relationships and unintended consequences that shape trajectories of illness and disease. Complexity theory directs us to consider the relationships between humans and their social, cultural, political, and economic environments. These parts are critical. Complexity theory also directs us to consider the interaction between processes and systems operating at different geographical scales, from the local to the regional and the global. Bye for now.